Sinopharm vaccine slated to arrive in the Philippines soon. But the problem is, both vaccine brands have not been granted EUAs just yet. Sinopharm has not yet even applied.
The Food and Drug Administration says the use of Sinopharm shots is crucial to President Duterte's health, which is a national issue. PSG staff and their close contacts will be allowed access to 10,000 doses of Sinopharm vaccines.
Ang allowed lang na mag-apply for a compassionate special permit would be a specialty group, a specialty society. For example, the Philippine Society of Infectious Disease Physicians, parang ganyan, or Philippine Chest Physicians, or a specialty institution such as a hospital. So in this case, PSG Hospital yung nag-apply. Kung mga halimbawa, vendor ka, nagtitinda ka ng bakuna, or yung commercial, hindi pwede yun.
The spokesman of the Philippine General Hospital, or PGH, will be the first to receive the COVID-19 vaccine, to be followed by all the health frontliners of PGH, which is among the priority hospitals in Metro Manila to get the first COVID-19 vaccines. How does it feel to be having the first vaccine shot?
On a different topic, 1 in every 800 Filipino babies has Down syndrome, a genetic disorder that requires care and attention because persons who have them are at high risk of health conditions. What are the support services available for more than 100,000 Filipino families who are living with persons with Down syndrome? We discuss all of that in this episode of The Chiefs.
And welcome to this weekend edition of The Chiefs. With us, of course, in the studio is Robbie Lampayo of One News. And joining us online is Ana Marie Pamintuan of the Philippine Star from the Port area in Manila. Lucy Cruz Valdez will not be joining us tonight. Ami, Robbie, happy weekend.
Happy weekend.
And Kong Hei Fat Choy.
Kong Hei Fat Choy.
Pronounce it right? Tama ba? Kong Hei Fat Choy?
Kong Hei Fat Choy.
Okay, there you go. And happy Valentine's na rin. Sige.
Hindi. Ano to, Chinese New Year to, polka dot.
Yun pala yun. Okay. Well, some big stories today. Pwede nang manood ng sine. As soon as the regulations come out.
But we're getting word now that many mayors are actually opposed to this.
Yeah.
Diba? Kanina, we interviewed Presidential Advisor on Entrepreneurship, Go Negocios, Joey Concepcion. Of course, he was saying, syempre, sistriktuhan to, the private sector will be ready. But this is still about balancing saving lives and saving livelihoods. But, as we pointed out, the mayors, who also stand at that intersection of saving lives and saving livelihoods, they don't seem to be behind this.
Kasi they will be the ones to handle whatever is the output or the outcome of loosening up. You have a movie house nga naman na madilim, tapos people bumping into each other and all that.
I remember the last time there was a move to open up malls to younger people, it was the mayors as well who pushed back against that.
Although you can imagine this is a move to spur growth in the economy kasi the cinemas are, of course, one of the main attractions of malls. You get more people.
Na-inspire siguro yung IATF ng Valentines. Kaya lang, one day too late siyang reopening ng cinemas.
Kasi di pa ma-implement ka agad yan. Wala pa rin mga implementing rules dyan.
Na-inspire ng Valentine's.
One day daw yung reopening, di ba? One day na.
Okay, Ami, will you do the segue or will I?
Ikaw na.
Sige,
Siyempre, puro
wala
COVID
nang segue.
pa rin tayo.
Our segue was the introduction itself kanina. We are joined, for our first guest for tonight is the spokesman of the Philippine General Hospital, Dr. Jonas del Rosario. Dr. Jonas, thank you for joining us and welcome to the Chiefs.
Hi, good evening.
Magandang gabi, Doc.
Doctor.
Happy New Year.
Okay, happy New Year. Well, we have Doc Jonas because Doc Jonas has been appointed as the face of the medical frontliner, the first one to be vaccinated, well, legally vaccinated in the Philippines when the approved vaccines do arrive legally in the country. Doc Jonas, I don't know if I should say congratulations, I suppose. But parang hindi kayo sigurado.
We're very thankful. So I'm speaking in behalf of all the frontliners in PGH and of the whole country that we're very thankful that finally the vaccine is here, and it's an added protection for all of us.
Dr. Jonas, you were quoted as saying earlier na whatever vaccine is approved by the FDA, you are willing to take the first shot. Para kayong si Jose Rizal, you are willing to take the first shot so long as it is approved by the FDA. And I understand that the last survey of the PGH, mga 93% of the PGH frontliners have agreed also to take the shot. That's I suppose that's a very good vote of confidence for the FDA approval process. However, I should also have to ask you, what happened to the other 7% of the medical frontliners of PGH? Bakit po parang hindi sila boto?
Okay, let me just, the initial survey was 75%. There was a survey about a month ago. We surveyed about 2,000 employees of PGH across the lines, and about 75% said, okay, magpapabakuna kami. 25% said hindi pa muna. So almost very little na absolutely no. Okay? And then we had about a week, or actually 3 days ago, we started doing the actual registration and screening. And to our surprise, in a way, pleasantly surprised, the percentage of people who would like to be vaccinated based on their actual registration is almost close to 94%. So there was an increase of almost like 20% from the survey. So now you're asking me, ano ba yung 6%? How come there are still some who are undecided? Actually, most of them have their own reasons. Mostly, they just want to see, they're not ready yet. They want to wait for the long-term follow-up of patients or those who had been vaccinated. I think there's also, to some degree, their negative misconception, or at least what happened in the past about the dengue vaccine also came into play.
Yeah. Pero
So,
Doc,
right.
yeah, yung
Go ahead.
20% na or so na tumaas, what happened? I mean, between the time of the survey and until the time na magre-register na kayo, what happened?
So I think it's a combination of factors. One, we addressed a lot of the concerns of those who were undecided. So after that survey, we made a massive campaign, an infographic, as you might call it. We started giving them the basics of vaccines, the different types of vaccines, the side effects. So I think education helped. I also have to admit that there was also some bandwagon effect when people actually saw some of their colleagues and most of our healthcare workers lining up for registration. Some sort of alam mo naman, minsan, sige, sama na din kami, no? So that means they don't really feel strongly against the vaccine. And thirdly, it has a little bit, I have to be honest, some say that it's because they're sure that they already know the brand of vaccine that we will be getting.
Which is Pfizer. I was going to ask you about it kasi nag-coincide yung pag-akyat ng number ng interest sa PGA with the report na ang dadating is from the COVAX facility, which are Pfizer and Moderna and possibly AstraZeneca. So you think that also played a role? Bigla-bigla naging willing ang mga frontliner na magpabakuna nga.
Yes, I have to be honest, because I have asked some of those who were undecided initially, and then when they learned that it's going to be Pfizer, then the confidence went up. A lot of these people have relatives abroad. We have a lot of friends from the US who have been showing that they already had the vaccine, like Pfizer or Moderna.
Hey, Doc, I have to ask, under the program for frontliners and certainly for the staff of PGH, kasama po ba ang mga pamilya nyo? And we ask in all sincerity because, of course, you have to go home.
You deal with this every day.
Yeah, you deal with this every day. You go home every day. Coming both ways, there's vulnerability and risk there. So, kasama po ba ang immediate family sa program?
No, we don't have enough doses for our immediate family. So basically, only those who are working in PGH, whether you have a plantilla position or you belong to the contractual workers, or you have been like a job order. Everybody who is inside the PGH complex working for the hospital will be vaccinated. Unfortunately, that will not be extended to your household.
Okay, I ask because, I mean, this is not to lure you into another controversy altogether, but yesterday we were reporting 10,000 doses earmarked for the PSG, for the Presidential Security Group. And people were asking, you know, we can understand the argument for the people, the close-in security of the president having to be inoculated, but why 10,000? And one of the things that's coming out is because kasama ang pamilya ng PSG.
That's according to Dr. Domingo
Correct,
himself.
exactly, according to Dr. Domingo. If that can be justified for the security of the president, why can't it be justified and allotted for frontliners?
Well, you know, right now we have a shortage, no? Probably if we have a scenario that we really have so many vaccines available, then we really have to prioritize. Even in PGH, we have a prioritization list, no? And we followed the DOH and the WHO. Basically, of course, we would like to first give them to the healthcare workers who are really directly involved in taking care of COVID patients. And down the line, alam mo, malaki rin ang mabibigay sa PGH. We're one of the biggest, no? We are asking for 6,000 doses because after our registration, initially we thought we will have close to 5,000, but then after the registration, we actually need 1,000 doses more. And medyo nakaka-guilty rin in a way if you are going to ask for your relatives or your family. That's basically depriving other frontliners from other hospitals, really.
Well, Doc, we will certainly appreciate your concern for the other frontliners. Pero yung nga po, following up on Robbie's question, if the PSG's, members of the PSG's direct family would have their own vaccinations early on, ito nga, compassionate approval pa eh. I suppose the question would be, why not the frontliners who deal with disease and COVID-19 every day? I mean, let me ask you. I don't mean to put you on the spot po, pero let me put it this way lang po. Do you think there is any desire by frontliners, medical frontliners, to also have their direct family members vaccinated early so that they are also protected from whatever you bring home? Wouldn't you also?
Yeah,
that?
I think that's a natural feeling. You know, you would like to protect everyone, not only yourself, but especially those who are vulnerable in your family, the elderly, your parents, the old ones who are. But we are in a situation that this is something that it's like a privilege right now. No? Parang that's how we look at it. So for now, really, we will just give it to the essential people. So at least our bargain is at least to give it to all people who are working in PGH, whether you are a healthcare worker or even it was even extended to secretaries in administrative offices as long as they are working in PGH.
Mm-hmm.
At least, doctor, I don't think there's a lot of opposition to the use of Sinopharm by PSG kasi marami ng Pilipino na there's an aversion to Chinese-made vaccines. Ngayon, sinabi ng mga government authorities na medyo madidelay yung pag-vaccine facility at mukhang mauuna yung Sinovac, which is arriving February 23. Meron bang pag-aalala ngayon sa PGH na baka kayo yung mauna ron?
Well, I guess that will be for those who really would like to get Pfizer, because there are those who before wasn't really waiting for what vaccine it will be. But yes, I heard that there is some concern now that there's a delay because everybody was expecting it's going to be the original, and now there is some delay, and then the news came out that the brand from China is coming. So, but it still has to go through EUI, FDA approval, AUA, get an EUA permit from FDA, and the health experts, the scientists, or the panel belonging to the vaccination committee has to look into it.
Mm-hmm.
So ang inaasahan nyo pa rin will be the shots that receive EUA from the FDA.
Definitely. So if kung mabigay po yung EUA for Sinopharm, and there's no Pfizer vaccine, then we have said in the past, as long as dumaan po sa FDA and it was approved by our experts, then we will get it. Dr. Domingo said it also. Sabi nga niya, he won't allow or approve a vaccine that he is not willing to take or he will not be willing to give to his family.
Doc, I think I can get the logic of why hindi lang medical frontliners but the spokesman for the medical frontliners ang mauunang mabakunahan, because we're heading into a phase where it seems as crucial not just to have the vaccines here but to convince people to go for vaccination. What's your basic message to everyone? Because as you know, confidence level is not very high right now. You started from a base of around 70%, and that was people who understood and who are surrounded by fellow medical frontliners. Our people are coming from not that, they're coming from their own homes, their own neighborhoods, their own fears. What is the message, and what do you hope people will take out of seeing our doctors getting these shots?
Definitely, Robbie. Based on the community survey, it's not even 25%. And so we're hoping that the frontliners, anyway, we are leading the charge against COVID, and we are directly involved in taking care of these patients. We're hoping that if we set the example, and then hopefully being champions of the vaccine, we will be able to convince some other people, so that the confidence will be high. I actually already had COVID, and I have antibodies, and based on the studies, they say that the immunity is not really guaranteed. Like, we don't really know how long I will be protected for having my natural infection. And so I'm willing to take that vaccine just to at least tell everyone that we believe in the science, and we really need to promote this so that we can at least get the herd immunity that we are aiming for.
Doc, as a practical matter lang po, yung small number, the minority who are not yet that convinced in the PGH that they should get the vaccine immediately, what happens to them operationally? Kung hindi sila nabakunahan, will they be assigned to certain areas or barred from being assigned to certain areas, and so on down the line? So how will it play out?
No, it's not an excuse to be assigned to a non-COVID ward. No? So, because it was offered to everyone, and so you have to take your assignment.
Okay.
So if you are still a COVID ICU nurse, then you will still be assigned there.
It's the same risk pa naman now, eh. Yeah.
In the meantime, Doc, what's the situation in the PGH, your referral center? Nagpa-flatten daw dito sa Metro Manila, at least yung mga cases. Kumusta na po? And how worried are you about the new variant?
We're very happy that after the holidays and after the traslasyon, the numbers never really went up. We didn't really feel the effect. Right now, we have about 65 patients only in PGH with COVID. We went as high as 250 a day. That was during July and August, when the healthcare workers were asking for a timeout. And slowly after the end of the year, we saw continuously the decline of the numbers. So we're very happy that it seems like we are in control, and that means our non-COVID operations are expanding again. So we're able to take care of others who do not have COVID, like our cancer patients, cardiac patients, other patients who were sort of like our collateral damage for being a referral center. No? So that's good in a way, and we can concentrate more for non-COVID. And so we feel like this immunization is like the last phase nga. If we can get this done, then hopefully the numbers really will even be lesser.
Yes, pero paano yung UK variant na meron na nga raw report dito sa atin? Is there any special preparation for that?
What we have been doing in PGH is every COVID positive now will have their PCR will be analyzed in the Philippine Genome Center. We are in what we call biosurveillance. So far, we haven't had any patient admitted to PJ who has the UK variant. No.
Okay.
Now there are also studies saying that even the UK variant, the current vaccines, the Pfizer and Moderna, they still have some degree of protection for the UK variant. No, so I think the other thing that is being looked into the vaccine, it might be like a seasonal vaccine, like you get the shot now, and then maybe after a couple of years or even a year later, you might have to account for the variation, and so it's like having a flu shot.
Ay, nabanggit nyo, Doc, no? I mean, yes, it does seem like we dodged a bullet. Maybe not completely, but the worst scenarios we had in mind with Traslacion, the Christmas holidays, and so on, it rose as we expected, not quite to the levels that we were really paranoid about. And then now we're seeing it going down. Now the vaccines are coming. We see light at the end of the tunnel. But at the same time, now the pressure on the economy to really open up is starting to build up as well. I'm sure going to PGH, nakikita nyo, ang traffic na ulit ngayon. And now we just read out the news that IATF has recommended opening up of cinemas. Are you concerned about that as well? Or do you feel that, as Mr. Joey Concepcion said, the balance between saving lives and saving livelihoods is proceeding at a reasonable and manageable pace?
I think the lifting or the lessening of the lockdown is reasonable. Really, I think we're one of the countries na napakatagal na nung lockdown, right? People have adjusted. In general, I think people are following the infection control measures. I think most of the people that I see, nagmamaskara naman, they even have face shield. And it seems like even parang crowded, the numbers are decreasing. So I think it's about time also to allow a little bit, ease up a little bit. Of course, we have to remind the people to continue protecting themselves, no? And then this vaccination will be also an important element of this, the lifting of the quarantine, or at least allowing people to be able to do what they need to do. Probably we won't be able to go back completely the pre-COVID ways that we have, but at least somewhere in between, I would say.
Doc, practical question lang po. I have to ask a doctor about this. Kasi nga po, we don't know yet kung gaano katagal ang efficacy ng bakuna. But how do we know? How do we find out? Do we wait until the first people to get the vaccines in the country start getting sick of COVID before we decide that we have to get another shot next year, for example?
Yeah, there are studies going on abroad. No, what they do, there are many ways of testing it. You, let's say, have a group that those who got vaccinated, a group that never had COVID, got vaccinated, and those who had COVID and got vaccinated. So merong mga difference. So that's one way. Really, yeah, you have to somehow monitor if there are patients who had, let's say, had been vaccinated and then had a reinfection, no? So they will become symptomatic, and then you will have to test again, no? So far, based on the studies, they say up to 6 months you're still covered. They look into people who had the COVID infection, the natural infection without getting the vaccine, and they have been following these people. It's like a prospective study. Every now and then they will check their RT-PCR. So they're monitoring these patients and see if they will have another RT-PCR positive. It has to be a different strain though, no? Kasi, yeah. So,
but Doc, that's like saying that kailangan nating bantayan kayo come September ulit kung
well, ang
in 6 months.
mangyayari niyan may self-reporting no? You have to in a way be aware of the symptoms, and then if you have symptoms, then you have to tell. Kunyari, nabakunahan ka, so you're hoping wala kang mararamdaman, and then now you started having fever or flu-like symptoms, you really have to be tested for COVID just to see. Because there are other illnesses naman.
Are you also making exemptions sa vaccination, like people with severe allergies sa mga health workers nyo, or those above 65? Hindi nyo ba sila isasama?
Okay, so ang mga absolute contraindication right now will be anybody less than 16 years of age. So kasi wala pang clinical trials on the kids, on children. So 16 ang pinakabata. There are some vaccines, 18 ang pinakabata nila. So definitely, if you're less than 16 or less than 18, depending on the brand. The second is if you have anaphylactic reaction to the components of the vaccine. No? Let's say, ang isa palang preservative niyan is yung polyethylene glycol. Yung
Kahit minor lang? Or it has
no, it has to be like an anaphylaxis, no, a severe allergic reaction. So yan. And then, yung seniors po, relative contraindication. Kasi yung more than 65, in fact, these are some of the people whom we want to vaccinate, the elderly with comorbid conditions. So it's not an absolute contraindication. There is some, there was in Norway wherein the frail, the really elderly in nursing homes were very sick. Talagang may sakit sila, may iba silang conditions. No? Tapos, yun lang mostly. The other relative contraindications are like, let's say you are, you have cancer and you're undergoing chemotherapy, so your immune system is kind of suppressed. So it is not a contraindication. Maybe we will just delay the giving of the vaccine.
Doc, mga buntis, or for that matter, nursing mothers?
All right. So yung mga buntis, hindi naman yan contraindicated. But having said that, it's probably better not to give it during the first trimester. And then if you're, you weigh it out with your OB and see, ano ba, are you really someone who needs to be vaccinated now while you're pregnant? Are you really a high-risk individual to get COVID? Let's say you're like really a frontliner ba, or you can wait a little bit. So it's not an absolute contraindication, but it's something that has to be individualized. Ganun din yung nursing, yung nga nagbe-breastfeed, for example. They say it's not a contraindication also.
Yung may lupus, pwede?
Yung may lupus, if they are being given steroids, no? So their immune system also might be quite low. But they say actually pwede rin eh. Kasi nga ito yung mga immunocompromised. Sometimes the only issue is they might not mount enough immune response to the vaccine. So the vaccine may not work. But in reality, you also would like to protect these patients who are getting some form of treatment to their illness.
Okay. Doc, again, nasa basic questions pa rin tayo, and I hope this illustrates, ang dami talagang tanong ng mga tao. Yung pagka nagka-shot ka na, so you're protected for, we still don't know how long, but kung protected ka, that's different from not being a carrier. Is that right? So you can be protected in yourself, but you still assume that you are a carrier? You could be a carrier?
Are you saying that, let's say you have been vaccinated, fully vaccinated, meaning you got 2 doses?
Yeah.
You're asking me if there is a chance that you can still get COVID and unknowingly be able to transmit the disease.
Yes.
Is that what you're asking?
Yes.
Right. Okay. So let me clarify. Kasi yung trials, what they did was, when they were looking at these subjects, what they did was they monitored those who had symptomatic COVID. So kunyari, binigyan ka na ng bakuna, after, then they asked their subjects, kapag may naramdaman ka, then you have to report to the investigators, and then you will be tested. Okay? So in Pfizer and Moderna, they were really looking for symptomatic COVID. So what is unknown are those who were asymptomatic, kasi meron din namang mga asymptomatic COVID. No? So when you say 95% efficacious, what they meant was 95% na hindi ka magkakaroon ng symptomatic COVID-19. No? So you're protected from, in a way, you're protected from severe disease. But you're right, it's still an unknown that if you had the vaccine, is it possible that I will contract COVID unknowingly, but I'm asymptomatic? Yes, it's still possible. But at least they say that even though you can transmit, it's less likely because you're asymptomatic.
Okay, one last final question. Yung efficacy is measured after the second dose. There's no such thing as parang protected ako after the first dose for X amount of time and so on. What's the difference of my protection, my level of confidence from the first shot to the second shot?
Robbie, we measured the efficacy both after the first dose and the second dose. But the investigators, at least from some of the vaccines, said that, let's say if you got the first dose, they say you at least have about 50%. There's about 50% efficacy already, which is, some say even 60%, no? And then if you get the second dose, that's when para bang that's your immune booster.
Booster.
It will go up to like 95 to high 80. So it tells you how important it is to get the second dose. But yung unang dose, may protection na din.
Okay.
Okay, Dr. Jonas del Rosario, spokesman ng PGH at yung unang makakuha ng bakuna na legal sa Pilipinas. Doc Jonas, maraming salamat po for what you are doing. And
Maraming
thank you for
salamat,
joining
Doc.
us.
Thank you, Doc.
Mag-iingat kayo.
Mag-ingat po kayo.
Kayo rin po.
You too, be safe.
Maraming salamat sa inyong lahat.
Opo, ingat po.
Okay.
We will just go into a break, so please stay with us.
Of our conversation, we will be joined later by Mr. Elmer and Ms. Agnes Lapeña of the Down Syndrome Association of the Philippines. But for now, we're still waiting for them. We're still having some technical issues. In the meantime, you know, pinag-uusapan natin yung vaccination ng frontliners. Obviously, he's not the guy to ask about it, but there's really that issue that I think is going to come up with PSG. With PSG personnel now being in line not just for themselves but their own families.
Yeah.
And then as we confirmed, actually binanggit na yun dati ni Yusek Vergere,
Yeah.
diba? And now confirmed by frontliners in PGH, that
Hindi
will
sila
not
kasama.
apply
Yung
to
family
the families of frontliners. Yeah.
And I don't know if it took them by surprise that the PSG family members are also going to get vaccinated.
I mean, nothing against it, di ba? But I think yung point ni Doctor is that, you know, there's also a question here for, you know, just the fact that there's a priority list.
Yeah.
And then the other fact that there is a shortage and short supply. So, yun lang, parang it's bound to happen that people are going to ask, what are the rules and are we following the rules?
Yan ang problema kasi wala nang rules na malinaw dito sa vaccination and we're all groping our way. Sabi ng PSG ang principal objective daw is to protect the president. And paano daw silang mapoproteksyonan kung yung pamilya nila mahahawa rin. Kaya kailangan yung buong household daw is safe from the vaccine.
But
diba?
the president basically stays in Malacanang these days.
Ayun, yan. Siguro,
like the medical frontliners.
supposedly, inuna na yung close-in niya, di ba? Inuna yung close-in, so expand. Medyo konti pa nga yung kung 10,000 yan, 5,000 doses. 5,000 people, medyo malaki-laki yung contingent ng PSG.
Well, anyway, Ami, our next guests are now here with us. Joining us are Mr. Elmer and Ms. Agnes Lapeña of the Down Syndrome Association of the Philippines. Mr. and Mrs. Lapeña, welcome to the Chiefs.
Good
Good
evening.
evening, and thank you for joining us.
Hi, good evening.
Good evening.
Sir, you're with the Down Syndrome Association of the Philippines. I mean, how big is this organization? I guess more importantly, yung Down syndrome po, tell us about it. I mean, let's start with basic acknowledgement. You know, may stigma pa ba ang Down syndrome, and how is it like now, both for people living with Down syndrome and the families of people with Down syndrome?
Well, recently there has been a lot of awareness and more open mindedness about Down syndrome, knowing that it's a random genetic disorder that happens in one out of 800 childbirths. So it doesn't choose anyone. So we also know that there's scientific basis for Down syndrome. It's not due to heritage or yung tinatawag na nalahian or things like those. So a lot of the stigma has been reduced by now, and we also have the Magna Carta for persons with disabilities that bans against ridicule or making them the butt of jokes. You know? So that also has helped the cause of persons with Down syndrome. We have about 23,000 members now in Facebook. The association has been around since 1992, so we're on our 29th year, and we're celebrating the National Down Syndrome Consciousness Month this February.
But Elmer and Agnes, can we back up a bit and tell us more about Down syndrome and what makes it different or unique from for example, autism, which is something that people tend to confuse with each other?
Yes. Down syndrome is very easy to detect because of the physical features. They have upslant eyes, their face is round, they have these epicanthal folds, then their low-set ears, their neck tends to be wide, and they're short and a bit chubby. So you can easily see that person has Down syndrome. They're both neurological disorders. Autism usually doesn't have any physical, you don't see anything, and they look like typical people.
Outwardly, yes.
Down syndrome, yes, Down syndrome has, they're intellectually delayed, their speech delay. They have several medical concerns, but these can all be addressed through early intervention. So it's very important that the parents bring their child, their baby, to a doctor, first to their pediatrician, and who will refer the child to the parents to a geneticist to confirm if the child has Down syndrome. And then there are other doctors to address the medical concerns, and then there are therapists. Okay, but as Elmer said, there was 800, so there are more than 100,000 persons with Down syndrome here in the Philippines.
What are the most persistent misconceptions? You mentioned that awareness has gone up about this debilitating illness. I mean, can children with Down syndrome, for example, attend regular school? Can they work later in life? What are the persistent misconceptions that you would like to dispel?
Yeah, please allow me to just say it's not an illness. Down syndrome is a condition. It's a genetic condition where they have an extra copy of chromosome number 21. Sometimes it's called as trisomy 21, which is the more scientific term. Everybody has, normal people have 46 chromosomes or 23 pairs, and persons with Down syndrome have 47. So it's a condition, and every cell in their body has an extra chromosome. That also causes some delays in their cognitive ability or learning ability and development. So it's so important that they undergo the right therapy to help them to develop as normal as possible to maximize their potential. The other thing, the extra chromosome can also cause medical defects and concerns. Like 30% of them may have congenital heart defects, which need the right attention, and if done early detected and the medical intervention is done early enough, then it can be so much better for the child's development and future growth.
Yeah. Beyond the individuals and their families, kumusta naman yung ecosystem natin for supporting everything from education or even therapists are there enough practitioners specialists who can help them, and all the way to employability. I mean, what about Philippine society right now is already there, and do you think can also stand improvement?
Well, employability is something very interesting because while we have what they call this underemployment or high unemployment rate in the Philippines, these the persons with Down syndrome can still be productive and they can still contribute to society. So in fact, this has been a program that we've been working on for many years. Thankfully, we have some organizations and some companies that have actually given our members opportunities to experience work. So we actually had the program with Shakey's that was ended but during the lockdown. And we had about 30 stores already where we had children with Down syndrome doing what they were capable of doing, whether it's setting the table, meet and greet, giving the menus, and some of them even did more than that because of their increased capability to do more. So this is something that other companies like South Star Drug has actually put into regular employment about 6 persons with Down syndrome as of last year. And there's also this company, Wings Technology, that has also put a person with Down syndrome among their full-time staff. So there are many opportunities for employment, which we actually encourage more companies to explore adding persons with Down syndrome to their workforce, because it actually has a positive effect not only on the child or the person and their family, but also on the co-workers and the organization itself to embrace diversity and to embrace disability, which is part of our everyday lives.
What about education and SPED? What is the state of SPED in the Philippines?
There are both private and public schools that have SPED programs. So it is important that the parents who advocate for their children will go and shop around, look for the school that would best suit their child. So with the help of the therapist, the developmental pediatrician, who can assess the intellect, the IQ of the child or the capability, then there are schools like, for example, our son started in a regular school with other typical children in preschool, and then as he became older, we realized that he had to be in a SPED program. So, but we have cases of persons who have graduated from college or are in high school right now. So this is progress. It was different before, but now there are more schools open to accept our children.
Well, it's admirable that some schools and some companies recognize that people with Down syndrome could be productive as well. But let me ask you about the general public, about for example, strangers in the mall or in church. How is it like when you come across strangers? Are they receptive, or have things improved already?
We have a very strong partnership with SM Cares under the SM Foundation. And every quarter, they have this sensitivity training where the frontliners, their janitors, the tenants, their security, salespeople, are given a 30-minute lecture by Down syndrome, autism, and this is for them to know how to handle persons with disabilities. So Down Syndrome Association is a part of this program. And it has really made a lot of difference when we bring our son to SM. I mean, he is accepted, he's welcome. Some of them know his name. And we are not afraid of him getting lost in the mall. because we know that he will be taken care of. We know that they will bring him to the office and we will find him there and he will be safe. And there are like for example, as Elmer mentioned earlier, this restaurant that has a program for persons with Down syndrome. Every time we have a child there working in Shakey's, we make sure that there is a 30-minute seminar where the staff will learn or will know how to deal with our children. So there's more education, and now that they are exposed, they work in the restaurant. The clients see them, they appreciate their presence. They see that they can do much more than what we knew, about Down syndrome several years ago.
That's good to know.
How is your son doing in this pandemic? There are a lot of restrictions even on all of us. How is he coping with these lockdowns?
He's with the program on hold. He's part of the Shakey's, we call the Love Him Down program. We enrolled him in a virtual class where he does academics, art classes, and cooking, and he enjoys doing them. And on weekends, with the dad,
Yeah, we play golf actually, which is one of the
Wow.
safest
Golf.
sports. Yeah.
How do you do that? How do you do?
oh,
How do
he's a
you
good.
play
He has a perfect swing.
Yeah.
Elmer, Agnes, what about us? What about us in media? I mean, what can we improve on? Or let's bring it out. What are we not doing right?
Well, we have to thank you actually for having us. This opportunity for us to talk about Down syndrome and to bring it to the public is really very important. We wish that we can continue this regardless. We have so many different occasions to celebrate and so many kids that we can actually talk about and feature on your program. Perhaps one of the more popular kids has been Brina Maxino, who has actually met the U.S. president. So she actually is a global youth ambassador for Special Olympics, an international role that many people may not be aware of, and she's Filipina. So there are many other persons with Down syndrome who have quite a number of achievements. We have so many achievers, and perhaps featuring them on your program and media just recognizing them for what they can achieve and what they have done and how they can contribute to our society is actually something that I think media should pick up on.
Yeah, but when I ask about media, and I do appreciate that, and we do want to play our role as well. But when I ask about media, I'm talking about including entertainment, including the entertainment industry. And I say this as somebody who grew up, in the 70s and the 80s, and there were a lot of stereotypes and misconceptions that the entertainment industry, TV and movie, were unfortunately aggravating. Is that still ongoing, or do you think, would you say that entertainment content has improved also?
Yeah, just sometime a few days ago, maybe 3 days ago, there was this blogger on Facebook who was using the M word. I'll say Mongoloid, and that the photographer was Mongoloid, and she was also acting. So I called her attention, and still she said, she wasn't really insulting because she did not know about that word, which is actually Down syndrome. So I guess that's one of the things that we have to do. We have experienced this from politicians, from newspaper writers using the M word, and so we have a lot of materials that we can share with the media, so that you can also spread that don't use the M word.
Yeah.
It really hurts parents to because like in our case, disability was not part of our world until we had our son Jeremy. But now that we do, we are advocates, and we appreciate that there are other people who have also embraced our children, and we see that the number is growing. We have partners. The association has several partners who are willing to support our cause.
Can you network with?
And by the way,
Okay. Please go ahead.
Sorry?
Go ahead, go
Go
ahead.
ahead, go ahead.
Yeah, this month is very important for us. February is National Down Syndrome Consciousness Month. So we have one whole month to celebrate the lives of our children, to promote awareness, to tell them about how great our children are. And, you know, it's something that was difficult to accept. But if you join us on Facebook, you will see how the parents and the siblings, the families are very proud of our children. There is a stark contrast from their reaction when they were born to now, because the truth is they bring us so much joy. We rejoice in every milestone that they make. Like our son may not be as verbal as other children, but he's a very good golfer. I mean, he has a perfect swing, and he can work. You know, he can be a waiter, and he's an altar boy. And all these parents have stories to tell, and we would like to invite you to join us on Facebook. And the highlight of this month is our virtual happy walk on Feb 21st at 10 o'clock in the morning.
When you network with other parents, what do you tell them? What's your message to them? Oh, drawing
Well,
from your experience.
you know, it's very different when a doctor tells you that your child has Down syndrome. It's very different when a parent tells you, I've been there, I know what you're feeling, I know what you're going through, and believe us, we know that things will get better, and you will be happy, you know, later on. The trauma is just for a moment, and, you know, you will actually have a lifetime of joy together with your child. So that's our message to all new parents. You know, love your child, and your child will bloom. This is something that you know, we like to get out to all parents of persons with Down syndrome as early as possible, to change their minds in a more positive way.
Well, Elmer and Agnes, baka there are families out there who don't know who to talk to, don't know who to get in touch with. Your contact details, for example, your Facebook account, so people can get in touch with you.
Yes, you can find us on Facebook, Down Syndrome Association of the Philippines Incorporated, 23,000 members. You can't miss that. And in Manila, we have an office. The number is 8895-9642. Outside Manila, we have an office in Cebu. We have an office in Davao. And we have parent support members all over the Philippines. So no matter where you are, contact us on Facebook, and for sure, you can find somebody who's close by to you. And, you know, us parents understand each other. So we actually become good friends, and we actually establish a lot of good relationships through the years, and people we've been meeting again and again. And so this is something like a blessing to many of us, and it's something we're actually thankful for. So, you know, there's so many positive things about having a child with Down syndrome that we are so happy for. And we wish all parents the same thing.
And if I may add, here we actually have the government supporting us. We'll be having some seminars, webinars, like the National Council on Disability Affairs will have a webinar on February 27, and the LGU of Malolos on the 24th. And we expect to have more webinars partnering with the different government agencies, and these will all be announced on Facebook.
Okay.
Yes, just contact us on Facebook, because that's where you can see all of these events and get in touch with all of the parents, and you can contact us if you have any questions.
Okay.
Okay.
Mr. Elmer and Mr. Emma and Miss Agnes Lapeña of the Down Syndrome Association of the Philippines, thank you for your courage, and sana more Filipinos join you in your journey.
Thank you.
Thank
Happy
so much.
New Year, happy
Thank you.
Valentine's, happy weekend to you.
Thank you po.
Happy
Ingat po.
Chinese New Year.
And that'll be all for this weekend edition of The Chiefs. It's a weekend, and it's almost Valentine's. We hope our discuss here will keep the conversation going. I'm Edwin Gao.
I'm Mami Paminton of the Philippine Star.
I'm Robbie Alampay, and we are One News.